Well, Dr. Tara Scott, thank you so much for joining me on the Checkable Health podcast. It's so nice to see you.
Yeah, thanks for having me.
You're quite the celebrity on social media. I have to say, I'm very impressed with you being a physician as well as you're an all-star marketer and business
Well,
owner.
I have a daughter who's a business major, and so she convinced me to get on TikTok, and now she's become my social media manager, and she's helping me manage stuff. So I had to look to the kids to help me how to do certain. Hey, can you help me do this trend? How do I do it? So it's the
Yeah.
kids that are helping me.
And are you seeing that your lives are doing really well on TikTok?
Yeah, and they're so variable. Like this time of year, it's a holiday season. So I'll have, some lives that I'll have hundreds of people on, and thousands of people watch. And then I'll have some lives that it's not very many, less than 100. But in general, most of the time, there's people who appreciate the information. I just kind of turn on the camera and just answer whatever questions come in, as many as I can, and usually till my phone battery dies. So um,
Yeah.
it's not really super structured, but it seems like it helps people. And that's kind of my goal, is to maybe help people who can't find a provider to work with or have any kind of question that I could help them. I mean, obviously, because of my license, I can't give medical advice.
Hmm.
So if there's any way I can help people, that's kind of my purpose for being on there.
You get so many questions too. You'll sit there and scroll through and you see these questions come in like how does she even choose them? People are really in need of what you have, Dr. Scott.
Yeah, I
Women.
try for all of them, but what ends up happening is if there's a question that comes in and it takes me 2 minutes to answer it, then there's
Uh-huh.
20 that have come in and people keep repeating their question over and over because there's a delay. And so it
Yes.
clogs up the feed, and then I end up trying to scroll through. Okay, answer this, answered this. So yeah, I am actually I'm surprised at how many people aren't getting the information they need. So that's why thank you for doing these kind of podcasts. I know it takes a lot of time and effort to do this. It's your time. And that's what I think now that people are getting the information through
Yeah.
social media, podcasts, where when I started this type of medicine 20 years ago, you couldn't get this kind of information. I remember I went to medical school and there was no internet. So that's
Oh,
just
that's
me.
isn't that crazy? So in medical school, you went to medical school and then you are OBGYN. So you had a
Yes.
residency and a fellowship as an OBGYN
Yeah.
and
So
you
I did
practiced.
general medicine year, and then I did 4 years of OBGYN, and then I practiced pretty much normal OBGYN for 17 years, delivering babies, and then overlapped. After the first 7 years or so, I really saw a need for someone to learn more about menopause and even just hormone imbalance. A lot of it was spurred on my own infertility. I mean, I had endometriosis, I had irregular periods, and then when I tried to get pregnant, I couldn't get pregnant without drugs. And then once you get pregnant, there's nothing for you, right? Okay,
Mm-hmm.
you're
Yep.
not trying to get pregnant. So I was 33 at the time, way too young to be menopausal. And then
Mm-hmm.
there's nothing for me except for birth control pills, which obviously I
Right.
didn't feel like I needed birth control pills because I'd never conceived and I didn't really love
Mm-hmm.
the way I felt on them.
Uh,
So
yep.
that really led me to start really studying about it, and trying to find an alternative option for that kind of thing.
And so when you were talking that kind of thing of being conventional medicine versus practicing functional medicine.
So at first, I don't even know that it was called functional medicine, honestly, because like I
Mm-hmm.
said, I'm dating myself. This was circa 2003. And
Mm-hmm.
functional medicine may have been functional medicine on the coasts, but in Midwest
Mm-hmm.
Ohio, it
Mm-hmm.
was not even integrated. It wasn't even called integrative medicine back then. So it just became a hormone specialty. And then in
Okay.
2006, I became a certified menopause practitioner. So the North American Menopause Society is not integrative or functional, but they are kind of like the experts on menopause. So it really gave me kind of a foundation to know here's what traditionally is doing and the research. And I'm still an accredited member, today, and keep my certification up, even though it's not really the approach that I do, but I want to have access to the research to make sure what I'm doing is evidence based. You have
Mm-hmm.
some camps out there of people who maybe dabble a little and go to a weekend course in hormones, and then they might be
Mhm.
prescribing high doses or not really monitoring them correctly. And I've always been the type of person that had to like know everything and be the
Yeah.
expert on it.
Mhm.
So,
Mhm.
so that's why I try to make sure that there's science and evidence behind what I do.
Which your patients appreciate because there are so many. I think that's the hard part of social media and having access to all of this information is who can we trust? Because anyone can hang up their profile and say, I'm an expert at this. But I really, and at Checkable, we really believe in those researchers, in the physicians, in the clinicians that live and breathe this and research it. And I think it's I really appreciate that you're not just doing groupthink. What you're doing is you're looking at your patients, and then through your research, you have your own practice now. So tell us about what is this practice, and how do you specialize? Today, I specifically, selfishly, I wanted to talk about hormones, and I love the what do we have here? Why diets fail,
Mm.
because those two things, as a woman, you talked about, okay, you have your babies and then you're just kind of like coasting, like, okay, well, what's the rest of my life? And then, oh, suddenly you're in menopause. But we have this whole season of life that we're experiencing symptoms, and you get blood work done and you're kind of like, well, what do I do with this blood work now? What's going on with me? I know I experience symptoms, but why? And
And
that's what I want to chat with you about.
I feel like that's actually the age that I have a heart for because, menopause is a year without a period, and then you're in menopause
Mm-hmm.
until you die. And there's a fair amount of research, and no one's going to tell you you're not in menopause. You either are or you
Mm-hmm.
aren't. I mean, it's a clinical
Mm-hmm.
diagnosis. You might have a provider not well versed on hormone therapy, and women are still being told not to take hormone therapy, which the North American Menopause Society says that between the ages of 50 and 60, there's more benefits for you to take hormone therapy than risks. Well, putting
Mm-hmm.
that aside, it's those people that were like me, 33 to 54, that had a hormone issue that were told there's nothing wrong with them. It's normal as you age. It's normal to put on weight. It's normal to have XYZ symptom. Even just yesterday, I had a patient come in who she's not even 40 yet, and she had already had like an endometrial ablation or a procedure for her heavy periods, and she's still having such painful cycles that she literally has to like hold on to the counter. And I'm like, that is not normal.
Oh,
Who is telling people
no.
that it's normal to not leave your house because you're bleeding so heavy, or to continue the weight thing? Makes I'm so sensitive about, because I come from a family who is overweight, and my
Mm-hmm.
genes and genetics are such that I was pre-diabetic. And I know that people try, and if you're not hormonally balanced, no amount of caloric restriction and
Mm-hmm.
increased exercise is going to work. And these women who are told, like, just lose weight, even people with PCOS, just lose weight and you'll be fine. And
Yeah.
that just bothers me,
Mm-hmm.
because as a traditionally trained OBGYN, I can tell you we are given zero education on how to manage hormone issues. We are told, we are taught, I can cut out a baby in an emergency C-section in a minute. I mean, I don't know if I still can, I
Mm-hmm.
haven't done it, but you know what I mean?
Yeah.
I graduated being able to do that,
Mm-hmm.
obstetrics.
Mm-hmm.
So, very little menopause training. I actually do the lectures for the local residency on menopause, but we're talking about 3 or 4 a year. So
All
that's not
right.
even enough. And so, as a traditionally trained OBGYN, you're taught how to get someone pregnant, how to prevent someone from being pregnant, how to manage a pregnancy, how to take out a uterus. That's it. And
Yeah.
so these are the
Gosh.
go-to people that women are going to. Like, what happens, my periods are XYZ. If it's a period issue, then maybe you'll get some attention. But even what about these people who can't sleep or have
Mm-hmm.
all of a sudden are depressed or have anxiety? And what are they given? Antidepressant when they're
Right.
really deficient in progesterone, or they have another
Mm-hmm.
hormonal issue, and then they gain weight because they're put on an SSRI, and that's one of the side effects, and their libido is low because those are the side
Mm-hmm.
effects. And they're not really deficient in serotonin per se.
Mm-hmm.
They're really deficient in their hormones.
Mm-hmm.
So glad that now we have social media. I mean, it's a double-edged sword. I get
Yeah.
some shade from some of the traditional, there's a few traditional OBGYNs on social media who really like criticize what I say.
Ugh.
So you got to get thick skins, but to reach the
Yeah.
people, I'm like, okay, just keep going. This person is happy that you told them this information or whatever. Just do it for them.
Right.
So there's
Right.
more. You have it more accessible to you now than you do than when I was your age.
It's so it's so mentally draining to Dr. Scott as a female going through all of this because of the images that we see out there in the media of and just as a woman you compare yourself to others and even our peers, and we're all unique beings, and just because something works for one person doesn't necessarily mean it works for you. And then we start like shaming ourselves, and why can't I, like, I'm dieting, I'm doing everything that I can, and then people kind of looked at you like skeptical, like, oh sure, she binge eats or whatever it is. And it's mentally so draining. And then to go, I literally created Checkable because I hated going into the doctor for my kids when they had strep throat. And so we're bringing an over-the-counter strep test through the FDA process of a clinical trial, so you can buy it
Wow.
at a pharmacy. I think it's the same thing when you go into your provider and you say, I'm experiencing these symptoms and I just need help. Like, what's going on? And then when you're sort of dismissed or you don't have any long-term plan, it's like, well, that is this is just how I'm going to live the rest of my life. Like hair falling out, for example.
Yeah, that's a
I've
huge one too.
Yes. So for someone listening that hasn't well, one, they will follow you now after this because we'll put all those links up. But let's say you're experiencing these types of symptoms, and I live in West Fargo now. What type of physician do I is it first listen to your webinar to educate myself? Like, how do you go through this process? Like, what's the first step?
Yeah, I do try to put a lot of free information out there, either with the YouTube channel, Tara Scott MD, any of my social media sites, or the webinar. But basically, I usually recommend for people to ask their provider, whether it's your OBGYN, is what experience do you have about hormones? Do you feel
Okay.
comfortable checking hormones? Because patients want to know, what should I tell my doctor to check? And even if you
Yeah.
go in a nice doctor and they'll say, sure, I'll order that, they don't know how to interpret it. And if you
Right.
literally look at estradiol, for example, at any time in your cycle, if you don't know when to put it in the normal range, it's going to be normal. It's always going to come back normal. So people are told, well,
Oh.
hormones are normal because they don't know what range, when to draw the labs, when to do it. So I think people get frustrated with me because like, well, what can I tell my doctor? I'm like, well, the thing is like, it's if you came to me and said, can you please speak to me in Greek? I would
Yeah.
love to communicate. I love languages, but I don't know Greek. I mean, I
Yeah.
know Spanish or Spanglish, whatever you want to call it. I mean, I would probably understand you if you spoke Spanish, but I don't know Greek. And so even if
Yeah.
I'm super nice and I want to communicate with you, I just don't know Greek. So I'm
Yeah.
not going to, even if you said, what are these Greek letters, and helped me. So I think, because now there's so much that people can do on their own, they still want to
Hmm.
navigate it themselves. And
Hmm.
so it's hard because, I'm restricted to a medical license. I can't give medical advice. Somebody who's not a
Hmm.
patient, and then somebody not in the state, and that kind of thing. So I try to put enough out there that is, like, for example, foods and lifestyle and stress
Hmm.
management that you can do that can change your hormones. Supplements, although those are usually an individual recommendation too. There's not one for everyone, but I try to put some of that information out there so that there are some options. And we do have the online course at Hormone Guru, .com, I think is hormone guru,
Hmm.
so that people
Hmm.
can go through that. And it's like a more in-depth explanation. And there's even like, these are the different types of testing, and this is what each one shows. So it's hard. I try to also put out information on how and where to find a hormone doctor. So, you could go to
Mm.
ifm.org. That's the Institute of Functional
Mhm.
Medicine. That's generally functional medicine that's more based on like family medicine, autoimmune. generally not hormone specialists. The
Okay.
number 4M, that's the anti-aging regenerative and functional medicine. That's where I did my fellowship and I'm on senior faculty there. So I speak to doctors and train them. They have a provider directory, but like again, anyone can join and pay a membership fee. So you have to look for member fellowship board certification. There's little icons.
Okay.
So you have
Okay.
someone all three. You can put in your zip code under directory and then say, I want to look for someone in hormone risk, and then look, there's little icons by their name in the directory. So that's a place you can actually
Okay.
go to the testing sites themselves. Dutchtest.com and ZRT Labs is the saliva test that I use the most. They have provider
Okay.
directory. So there's providers who
Oh.
use tests, and you could put in your zip code and location and look there. Obviously, if someone's ordering a Dutch test, they generally know how to interpret it. Um,
Mm-hmm.
so many hurdles, like even
Interesting.
it's such a specialized thing, even within the functional medicine world. Like not every
Mm-hmm.
functional medicine person does hormones or understands hormones. Like if
Mm-hmm.
you ask, we talked about Lyme disease. If you ask me about Lyme disease, I'm not your person. You know,
Yeah.
I kind of know about it. I know a little bit about it. I know what it does to your cortisol. I'm not your person to treat it. Just because I'm functional
Mm-hmm.
medicine doesn't mean. I mean, even like mold, I kind of dabble in that. If my patient has
Mm-hmm.
an issue, I'm not the mold expert. I'm the
Yeah.
hormone. So even
It's so
within integrative and functional medicine, you got to look for somebody. And one of my colleagues was asking me, how many integrative GYNs do you think are in this country? And I started to think, and I'm like, I could think of maybe five. Like
wow, really.
the ones that are teaching, the ones that have a profile. Not, I'm sure there's more than that. They just aren't,
Uh-huh.
on the radar. I was just trying to think like who's on social media, who has a product, who has a whatever, who teaches with me, who's
Yep.
actually OBGYN and has done similar training. So it's a
Yeah.
super special niche. I didn't realize that. So that is also another hurdle for patients getting the care they need.
Right. It is it's hard to find some because when you do look at a website of a functional medicine physician or practice, they sort of list everything. And you're like, well, are you?
Yeah.
Is that you? So, can you tell us? I'd love to hear some of your stories of the women that you've helped. Like, what comes to mind of someone that when they first came to you and then after working with you, what they experienced?
Well, certainly women who have issues with their periods, painful periods. I mean, there's one subset that I love to help, and this is like teens with acne that have been to 5 dermatologists or
Mm-hmm.
teens with menstrual issues,
Mm-hmm.
because it's generally an issue with estrogen detoxification. So if we run the dried urine test, we can find out and we can actually help them and prevent possibly, I mean, I can't prove it, but prevent endometriosis, prevent fibroids. I mean, that was how I dealt with my own endometriosis, is that approach. And I don't suffer with symptoms of that. And I haven't, for at least 10 years because I was able to balance my hormones. That's not everyone's maybe results. So I love
Mm-hmm.
seeing those patients. I really love seeing people in their 40s because I think about, that's when the weight starts packing on. That's when you
Yeah.
stop sleeping. That's when you have brain fog and women are, busy and working
Mm-hmm.
and they're
Mm-hmm.
balance a lot with work, with parent, taking care of their parents, taking care of their kids, trying to be, business owners, business, whatever, wives and husband, whatever it is. And
Mm-hmm.
so, you tend to put on about 3 pounds a year over 40. If you think about
Mm-hmm.
that, then by the time you're menopausal, that's 30 pounds. And if you keep
Right.
going and people keep telling you, oh, guess what? Exercise more and eat less, and you're restricting your
Mm-hmm.
calories, you're not getting results. So at some point they
Yeah.
say, forget it. So
Yeah.
a lot of those women either make too much estrogen or don't have enough progesterone or don't clear estrogen with their detoxification pathways. So that's super rewarding to be able to do. A
Mm-hmm.
lot of women in perimenopause, some of them, it's just a matter of overhauling their diet and lifestyle. And believe it or not, I ate crap when I was in my
Mm-hmm.
30s. I
Mm-hmm.
was delivering babies. I was eating convenience foods, processed foods. I always liked to exercise, but I really wasn't healthy. I didn't sleep a
Mm-hmm.
lot. And so I had to kind of overhaul my diet and, prioritize sleep and stress management and everything. So those things people can do if you guide them on how to do that. But some people need to take progesterone.
Mm-hmm.
And that's prescription, and it needs to be monitored and dosed appropriately to be able to help. And then once you get through menopause, some women need estrogen, some don't, but some do.
Mm-hmm.
The dosage matters. The way you monitor it matters. I mean, it's not like everybody should have a crazy high dose. I just was in Miami teaching a course last weekend, doctors, and the pharmacist is like, this doctor is giving everyone the same dose, X dose, X. And I was like, ee, that's a high dose. And like
Yeah.
everybody's getting the same dose. So at least he's listening and he's trying to use bioidentical hormones, but he's not doing it the right way.
Right.
So it's hard, but I think, I love even seeing even people in their 30s, getting them on the
Mm-hmm.
right path, helping them learn about how their body processes hormones, how important stress is, making sure their guts are okay. And then I think they navigate the change. I mean, I even look at, even my friends or people I went through med school with, and for the most part, everyone's pretty healthy, but I'm really the one who's really done I had the worst hormones, but I
Mm-hmm.
worked as soon as I did, probably less than in medical school. And I'm, still, I think look younger than I
You,
am, but
yeah.
so I think it's working on myself anyway, and the patients
Yeah.
that I, but sometimes the innovations that we do are not that drastic, not that
Mm-hmm.
costly, not that drastic. Yes, the problem is we can't control what the test costs. Dutch tests
Sure.
just increase the price of their test. We can't control everyone. A lot of times we just use traditionally blood work that people can run through their insurance, but you have to know when to order it, how to interpret it. And so a lot of the hormones I use for menopause are FDA approved bioidentical hormones that come in generic. Like I
Oh,
pay zero.
wow.
I
Yeah.
pay no copay for my estrogen patch. I do take a compounded progesterone. That's about 30 or 40, probably $40 a month, but it's not
Mm-hmm.
supposed to be crazy expensive.
Mm-hmm.
So,
So you mentioned three things that um, if your body isn't producing enough progesterone, if your body can't process it, those three things that you said. So do you then prescribe hormone? What is it like once you're diagnosed? Then it's the treatment plan, right? And that's why it's very important to see someone that knows what they're doing.
right.
How
So,
can
let's
we ensure that that is right?
Right. Let's take the teen with acne or the
Yeah.
teen with periods, for example. I'm rarely giving them a prescription. They usually
Mm-hmm.
don't need a prescription. It's usually that they're not clearing estrogen, their estrogen
Okay.
detoxification. And then with the acne, a lot of times it can be estrogen dominance or it can be gut bacteria. So they might need a prescription for that, an antibiotic, sometimes we use
Interesting.
herbal microbiome. I mean, I've had, like I said, teens that have gone to 5 dermatologists and they haven't been able to clear it until we've done some of the
Yeah.
testing, the stool testing, and the hormone testing.
That's
And
so sad. Like
yeah,
that's, I mean, as a teenager to have acne, is there anything worse? Like it's
yeah, and
awful.
some of it is diet, because the teens what they
Mm-hmm.
eat now, it's not very
Yeah.
good. So for those patients, I'm usually not prescribing anything, and certainly people in their
Okay.
20s. Once you get over 40, a lot of women, you just don't make as much progesterone because your eggs are aging. So it's
Right.
more common to need a prescription then. Not everybody does. Sometimes people respond to herbal supplements, or there's even something called seed cycling, which is a food pattern of how to help regulate your
Oh,
cycle.
yeah.
So as I get older, I probably
Mm-hmm.
prescribe less, and
Mm-hmm.
that's probably, evolving more that we're working more with the body and instead of trying to give someone something. But there are times when you do need to have a prescription, and that's even like some people might need something like metformin,
Okay.
sometimes we've been doing a lot of the semaglutide, which is for weight loss. And
Mm-hmm.
that is a prescription, but there's these poor people who have worked so hard and are, starving themselves and exercising and hormones have put on the weight, but fixing hormones don't necessarily take it off.
Right.
We
Right.
are using some of that for our patients, and because it is working metabolically, it's getting their insulin down, it's getting their sugar down. And so that's why I normally wouldn't do like a weight loss drug, but this is a little bit
Mm-hmm.
different because it's working with your metabolism. So things
Mm-hmm.
like that, it really depends on the patient. A lot of it is, we have a health coach in our office. A lot of it could be just education and partnering
Oh.
here's maybe you shouldn't eat this. Food sensitivity is another cause of, you know, unexplained weight gain, and it can also derail your hormones as well. When you gain more weight, your fat produces more estrogen. So it's just
Mm-hmm.
a vicious cycle. There's a lot of things, and in our environment, all the endocrine disruptors and all the toxins are messing with our hormones as well. So a lot of it could just be, identifying the problem, working with a plan on how to combat it. It's not always a prescription, but often it could.
Mm-hmm. Mm-hmm. It's reminds me of a woman that she was constantly working with a personal trainer and like paying an immense amount of money to see the best of the best, and had like food delivery programs, and she was following it, and she would get to her trainer and just not see her any the fat decrease, right? Like she was looking at her muscle mass, and she wasn't losing weight, and she just was like, I'm gonna get skinny when I guess I'm an old grandma at 90, like my mom got skinny. And we don't have to do that. So are you, tell me about your practice. Like I'm in North Dakota. Can we, do you have a practice that we can work with you remotely, or are you only practicing in Ohio?
Well, I do have a medical license in Florida and Montana, but we are restricted to whatever state we're licensed in. And the
Okay.
medical defines where you practice medicine as where the patient.
Okay.
So I know there's some people that get around it and work remotely with patients because they're coaching. So
Mm-hmm.
there might be a different licensure for coaching, but as a medical doctor, I have to abide by that. So now what happens is patients actually come in to Ohio for the first visit, and then we do the rest
Oh.
remotely. So I've had patients come from New Jersey, California, Las Vegas, Texas, whatever. And they're just like, oh, once a year, if I've just come in and have the appointment. So
Mm-hmm.
that can work for some people.
Mm-hmm.
I do have a network. I did sell my practice last year to Forum Health, and we do have a network. I think we have 28 sites. So there might be another provider at one of the Forum Health sites that they could work
Okay.
with, or I might have some colleagues. I don't have colleagues in every state. One of my
Mm-hmm.
colleagues created like a hormone club, so she's tried to get someone in every state. So it depends. Like I know people reach out to me all the time about it, and if I can help them, I do. If I don't know anyone near them, and then I don't know anybody, I don't want to
Right.
randomly recommend someone I don't know just
Yeah.
from a
Yeah.
directory. I kind of sometimes I'll look at the directory and say, well, this person's actually done the fellowship and got the board certification, so you could try this person, but I don't know them. That's what
Mm-hmm.
I think. So
But
so working, remotely, that's why I try to provide, just free content on the website, on the YouTube channel. We do have that online course, and we just recently have been partnering with a lab company, a lab distribution company, to try to even get the lab to be included in the course, which is also
oh,
the hurdle.
that's great.
People can't get the Dutch test or they can't get whatever. So we're like,
Mm-hmm.
well, we can do that. But then the problem is then interpreting it, and going
Yes.
there. And then
Yeah.
also, because everything is so personalized, they might say, oh, I did the Dutch test, but maybe they did it at the wrong time, or maybe they did, or
Yeah.
not the right test for you. Maybe you needed saliva. Maybe you just needed.
Yeah.
So it's hard because unless you take a detailed history, you don't know what type of test they need. So
Mm-hmm.
we do have, like I said, the online course, and we're working with the capacity to be able to add the test on, so for
Mm-hmm.
people to have. And
Mm-hmm.
then that might be two steps closer to finding someone, and you've already done the testing. So it just depends. I wish there was a way to help everyone.
Yeah. Well, of course you do. You have a heart for it. Obviously, you have dedicated your life to this. In watching your webinar, I really thought it like really spoke to me when you showed the picture of when you got married, and then you had a picture of you and your husband now, and I thought it was so cute because you said he said that this is okay, but you really haven't aged since you've been
Thank
married. And and he is a emergency physician and doesn't take as good of care. My husband doesn't either, so he didn't say that I could say that, but I will say it. Doesn't take as good of care of himself as I do. And do you think that's directly related to everything that you've done as the investment in your own body?
I think, I guess, and I don't know if you, I don't remember what the latest version of the webinar was, but my brother passed away at 38, suddenly of a heart attack. And I think
Oh,
when that happened, I mean, he had every risk
mm-hmm,
factor. He was a diabetic, he
mm-hmm,
was a smoker, he had high cholesterol. So
mm-hmm,
I was so affected by that because I felt that was completely preventable. And so
yeah,
that was a big turning point for me to and it was kind of coinciding. I was already starting to manage hormones, but I wasn't really functional medicine yet and into prevention.
mm-hmm,
But knowing that his death was completely preventable and he was 38 years old and literally just was hiking
mm-hmm,
and had a heart attack and died, it was just really affected me. And so, and affected my family too, obviously, such that, my dad's kind of super healthy. He's 83 and he's like obsessed about his blood sugar too. Same thing. So
mm-hmm,
I mean, that's kind of what made me do the shift. And so
mm-hmm,
it was a challenge kind of growing up with the two of the kids kind of subscribed to my point of view, one of them, his point of view, and, if it ain't
mm-hmm,
fix it and I'm
mm-hmm.
fine and not really, but
Yeah,
so yeah, it's definitely been a challenge and I've just kind of decided, I do what I do for me. And yes, yeah, you can make fun of me for taking these supplements or going to bed on time and not drinking a lot of alcohol,
mm-hmm,
whatever it is. But
mm-hmm,
that's what works for me.
mm-hmm. And how you feel great, and then you look great to prove it that it's working
Yeah,
for you. Yeah,
yeah. I mean, I
yeah,
think obviously it's not so much about the vanity of looking good, although as I
mm-hmm.
age, I'm starting to be like, oh, look at these wrinkles and this and that, but it's more just I feel like this is my ministry and my mission, and I want to be around patients and help patients, and so I have to be healthy. And you know, even since the webinar, we've had like our family was in an accident, and that kind of changed things. And so there's lots of
Oh,
things that
wow.
you never really know you're never guaranteed to have
Yeah,
health. So
yeah. And being a mother, I think that you're the example for, I have a daughter too, and just you're an example to her of what is that body image? How are you taking care of your body? And they see that. And like you said, either they're going to adopt one style or another, or choose their own path, but hopefully they adopt a healthier one.
yeah, 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 for sure.
When it the last thing I wanted to ask you about was um and this in regards to the dieting. That's just right this time of year, as moving into the new year, we're going to hear so many different, like, pushed all of these different diets, like, well, if it's keto or if it's, whatever, carnivore diet. And instead of being on this hamster wheel that we're on, what advice could you have for a woman that's like knows that she wants to make a change in her health, and what's a good first step there?
So pertaining to women in perimenopause and menopause, so that's really 40 up, even 35. I mean, everybody will respond differently to a diet, and that we're finding a lot about that's your genetics of how you process fat, how you process sugar. Most women who are either estrogen dominant or in menopause are carb sensitive. So
Okay.
any of the low carb diets like a modified paleo, even keto is a good place to start if you love to eat, meat, or if you
Mm-hmm.
like that type of cuisine.
Mm-hmm.
The study, they actually did a study based on, it wasn't keto wasn't involved. It was like Weight Watchers, Atkins, and paleo. And the
Mm-hmm.
one that people were most successful was the one that was most likely mimicked their palate, right? So if you're doing
Mm.
keto, like I don't love meat, I eat it, but
Mm-hmm.
I don't
Mm-hmm.
love it. I don't have any political reason not to. But if someone told me you could never eat meat again, I don't think I would have a problem.
Mm-hmm.
Um, So in general, there's a lot of hormones in meat. Like if you think about chicken breasts, how much bigger they are today than they were.
Mhm.
Be careful
Yeah.
about the quality of your meat and whether there's hormones are in it. I think a lot of people eat too many carbs and not enough protein, whether it's,
Mhm.
plant source. And I think the standard American doesn't eat enough plants, really.
Yeah.
So I generally make sure I have like even today for lunch, I was kind of pressed for time, and I went to like a local market to get my daughter's creamers, and she's coming home from college, and I got a piece of salmon, but I didn't just eat the salmon. I put it on lettuce, and I have my radish that I have every day, and my Brussels sprouts, shredded Brussels sprouts, raw, and
Yeah.
asparagus. So I like put that on a bed of it, everything. Like always put anything on a bed of lettuce rather than just having like the
Okay.
salmon. And
Yeah.
I have protein on a salad every day for lunch. So whatever is my
Mhm.
protein. And for me, I can't eat gluten or dairy. I have Hashimoto's thyroiditis, so I don't eat that. I try to
Okay.
do grain free, but there's a lot of allergens, a lot of inflammatory things in gluten and dairy. Now, I'm not sugar
Mhm.
free. I do
Mhm.
sugar. I have a sweet tooth. I don't
Mhm.
drink a ton of alcohol, maybe a couple drinks a month, maybe three, maybe
Mhm.
four at the most if it's holiday season.
Mhm.
Um, so I think just, decreasing sugar, decreasing alcohol, eating more plants, being conscious of your carbs and your protein,
Mhm.
in general, those are things that generally work for my patient. And then we sit down and we figure out like, oh, this person wants to do keto. Okay, well, here's how you do keto. Don't make it all about
Mhm.
bacon. Or this
Yeah.
person's vegan and all they're eating is the fake meat, which is all
Yes.
wheat and it's all carbs and they're vegan, but they're not eating very many vegetables. You know,
Right. Yeah.
it's that doesn't work because then you have so much
Mhm.
carbs. So you got to be
Mhm.
careful with that. But most women, if you are really mindful of alcohol, sugar, really, inflammatory foods, and
Mhm.
again, now it's not like eating 3 meals and 2 snacks. Now it's really going down to 2 meals. That's really seemed to
Mhm.
be like if I post what I eat, some people are like, "You don't eat any breakfast?" I mean, I do eat, drink something if I'm gonna run. I ran 6 miles this morning. Of course, I drank like a
Mhm.
pre-workout drink. I'm not gonna run on an empty stomach, but if
Right.
I don't, because all breakfast is gluten and dairy, so I don't
Yes.
really
Yeah.
tend to eat breakfast. I mean, sometimes I will, but I usually just
Yeah.
eat an early lunch and then I eat an early dinner and then that's pretty much it. And
Mhm.
yeah. So
Mhm.
going into like holiday season, I mean, I'm really just figuring out what works for you and being consistent and preparing. That's the other thing is I
Yes.
prepare everything. I mean, on Sunday, I'm like, okay, do I have enough of this? I like this local lettuce. So do I have enough?
Yeah.
Do I have my radishes, my Brussels sprouts, my avocado, and what protein am I putting on my salad?
Yeah.
And then I actually do a meal service sun basket just for 2 meals a week, so it delivers so that I cook it and
Oh,
then
okay.
you pick. So for me, it takes out the shopping and meal planning for at least 2 meals. The rest
Mhm.
of the meals, then I'm going to have to cook. My kids are coming home this week,
Mhm.
going to cook something Sunday night for them, and so I
Mhm.
try. Planning is really the thing. And even when I go out of town, I was out of town this last weekend. The first thing I did when I landed Friday, Google Whole Foods. Oh, I can walk to Whole Foods.
Yeah.
Let me walk to Whole Foods. Let me get my
Yeah.
staples, my snacks, my stuff that I know that I can eat.
Yep.
I'm always prepared with something to eat because I
Mhm.
can't do the gluten and dairy and I can't usually eat on the run. So for airports, I usually pack a lunch when I can. Coming home, I
Yeah.
can't pack something. So I kind of scope things out and make sure I have
Mhm.
something. But I mean,
Mhm.
planning, and once you do it, it's really not that difficult. It's just
Yeah.
overwhelming at first.
Yep. Yeah, and it's time management and it's not always being rushed to get to the next thing. It's being thoughtful about it, intentional. The alcohol piece, I gave up alcohol over a year ago, and I can't believe how that dramatically changed my life and just my overall way of thinking. It's very
Yeah, I
helpful
think
for
what
me.
ends up happening in women, your age, my age, whatever, is when they're not feeling well, they start to drink a little alcohol to calm themselves
Hmm.
down, right?
Yeah.
They're stressed
Yeah.
out, whatever, and then it turns into a drink every night while I'm cooking dinner or whatever. And it does help initially, but then it
Hmm.
disrupts your sleep, it disrupts your sugar.
Yes.
And I don't think people are drinking like they're getting addicting. I just think
Hmm.
there's another hormonal balance and it's calming
Hmm.
down and it's making you feel somewhat better. So that's why people
Hmm.
do that.
Yes. Yeah, that's funny. It was exactly, and I sort of followed my mom's pattern because when she would cook, and we like to cook, so I'd get home from work and I would cook, and that's like my love language for my family. But then I would have a glass of wine, and it would be probably more than a glass. But then I would get a headache, and I don't even know why I was doing it. I'm like, why am I even, this is dumb. It just makes me not sleep and feel even worse. And then you end up eating things that you don't want to be eating too. It throws your inhibitions out a little bit, even a glass of wine.
Yeah, the sleep is why. I did find a wine called Bev, Drink Bev, where
Okay.
it, it's a California company made by women. I love to support women businesses. It
Uh-huh.
has like zero added sugar. The sugar is a lot of
Okay.
times disrupts your sleep and everything. And it has like
Oh,
it's in
okay.
little cans, so you don't have to open a whole bottle. Four cans is actually more than a bottle. It's like a bottle and a third, but you could just open a
Mm-hmm.
can.
Mm-hmm.
Of course, I have that in my fridge and it's been untouched all these months. But if I wanted to have
Okay.
some, that's probably what I
Yeah.
would drink because
Yeah.
I've worn a continuous glucose monitor. It doesn't spike my blood sugar and I can sleep
Mm-hmm.
at night as opposed to if I have regular wine. I mean, it doesn't taste as great as wine,
Yeah.
but those are, sometimes I try to present those kind of options for people who it's a social thing for them and they don't want to give
Mm-hmm.
it up. Then we try to work around that issue.
That's interesting that you were, are you diabetic, that you wear a glucose monitor?
I was pre-diabetic, and my brother
Okay.
was a diabetic, and that's why he passed away so young. So I have worn it intermittently, like I haven't done it in a while, just because it teaches you a lot about what certain foods do to you. So I thought I was eating
Mm-hmm.
healthy. I was doing those daily harvest vegetable bowls, so all vegetables,
Yeah.
and
Yeah.
they were my blood sugar. It was too many carbs for me. Some of them are
Oh, wow.
so we're talking about Brussels sprouts and chickpeas and beans, and it was all, I don't know if it was vegan. It was probably vegan because I don't do dairy. So it was
Yeah.
probably vegan. It was a
Yeah.
convenient thing for me just to take to work. Well, then it was
Yeah.
totally my blood sugar. So I'm like, okay, I got to go back to having protein on my salad. So that's why I switched to usually I do chicken salad on greens or whatever. And for example, sweet potatoes spikes my blood sugar. But if I ate salmon with it and less sweet potato fries, then it didn't spike my blood sugar. So it really taught me about what was going on in my body. And it wasn't until
Uh-huh.
I did that with a little bit of intermittent fasting that I got
Mm-hmm.
my A1C and my blood sugar down.
That's so interesting. I've been wondering about just testing my own insulin because
Yeah,
I've been finding. And do you have to do a continuous? Is that by prescription? That I'd
so continuous glucose monitor is.
Okay.
You don't have to be a diabetic for some insurances. Mine covered it just as like impaired glucose tolerance or prediabetes. So we prescribe it for our patients a lot. For a lot of patients, we're checking metabolic labs, which is, full thyroid panel and insulin and glucose and A1C. We're checking
Mm-hmm.
metabolic hormones like leptin and adiponectin, which are inflammatory hormones. Leptin
Mm-hmm.
resistance can make you gain weight because you don't feel full, you feel hungry, and all of your hormones affect your hunger, your metabolism, and your glucose metabolism. So generally we're doing a pretty thorough evaluation on our patients that are coming in with if they had the unexplained weight gain complaint.
Mm-hmm. Mm-hmm. Now, one thing with your practice and with others, if patients are sensitive to a cash, a fee for service model versus insurance, uh, what is your how do you recommend, because you want to seek the care. I always think, don't let a dollar sign just impede you from living your best life. So how do you work with that with your patients?
That's been really difficult, and that is one of the things that I don't like about this industry because when I opened my practice, we were on insurance.
Mm-hmm.
But using that model, we had to spend less and less and less time with each patient, and there was
Mm-hmm.
times where like I couldn't pay my rent, I couldn't pay myself because they just don't reimburse you. Like we're
Right.
spending an hour with patients, they will not reimburse you for that much time. The
Right.
model is based on you spending 10 or 15 minutes with the patient and seeing
Mm-hmm.
when I was doing GYN 30, 40 patients a day. I'm now seeing 7 or 8 patients a day, you can do the math and you can see that you're not going to make ends meet. So I
Right.
slowly had to come off of insurance and find out other creative ways because I wouldn't compromise the kind of care we were given. So we have things like
Awesome.
we've negotiated lower lab fees for patients because I know for me, I have a high deductible.
Yeah.
So if I get my thyroid drawn, it's going to be like $1,400 and the insurance
Mm-hmm.
won't pay for it. I have to meet my deductible. So we've negotiated like $150. So I just pay for my
Yeah.
labs. I'll never meet my deductible unless, we have a catastrophic thing. So we do have some
Mm-hmm.
of those things ready, but it is a problem. And so that's why I try to do the social media. I've
Yeah.
done things like online boot camp challenges, and honestly, like we used to do more, but it's a lot of work in the evenings, and so
Mm-hmm. Yeah.
it's just been me that's kind of been resistant to doing, more. I have a partner who's a health coach who does my courses with me, and we just did a thyroid one, which we included the thyroid labs. So obviously we have to pay the lab for the thyroid lab, so it does cost something. I think we
Mm-hmm.
only I don't know, 5 or 6 people sign up. And so it's still our time creating it, doing it, facilitating it. And I'm like, I guess, I'm happy to do it, but if people don't want to come or do it. So that's how I'm trying
Yeah.
to figure out how can I help other people? Like,
Mm-hmm.
should I try to go back and we've done boot camps before that we've had 200 people in 14 states and 6 countries, but we haven't done that for a while.
Cool.
It's
Yeah.
a day in a row that we go through, hormone stuff and how to balance it. And we talk about detox and we talk about, food and we talk about a lot of stuff,
Mm-hmm.
fasting. And so, but it's just a lot of work, and
Yes. Yeah.
so it isn't a time in my life right now where I have that issue. So I'm still trying to figure out how, and doing things like this, like if I can help someone just by listening,
Mm-hmm.
or see something on YouTube or something, then I'll just keep trying to
Yeah.
figure out. But it is a major deterrent for a lot of people. I never really wanted to have like an elitist practice, but
Mm-hmm.
behind the scenes, there's a reason
Yeah.
why we have obviously
Yeah.
malpractice insurance and rent and all this stuff, and
Yeah.
I'm in this field because it's lucrative, right? I would have stayed delivering
Mm-hmm.
babies if I wanted to, if the
Right.
money I was in for, right?
Yeah.
So this is not the field to get into if you want to make a lot of money, but
But
it
you're
is
helping lots of people,
yeah, and
lots
that's
and
my
lots
goal.
of women.
It's
Yeah.
not, I'm fortunate, I'm blessed that, I
Mm-hmm.
can do what I want for a job. And so now, now that is my goal. It's not about the bottom dollar, but there are some people that, they have to pay off loans and they have to do whatever. We have
Mm-hmm.
2 kids at college, one graduated. So we have got,
Mm-hmm.
obviously expenses as well.
Yeah. Yeah. Well, what you are putting out on social and the webinars that you are putting out there, I am very grateful. And I know that even the women that work at Checkable are big fans of yours. So thank you so much for gracing us with just all of your knowledge and just being present and digging into this because we need it in the world. And let's hope 10 years from now this is all normalized and it won't be like so hard to
Along with
find. But
So I mean, what you're doing and what people are doing are moving the needle. It's not coming from the doctors, it's coming from the patients. And so they're pushing for it. And so it is so much more widely available than it was even 10 years ago.
amazing. Good. So that's progress.
Yes.
Well, we'll share everything, all the ways to get a hold of you and your URLs. And if there's anything that you would like to leave the audience with, um, it's all up to you there.
I really just, one of the main reasons I tell everybody there's 3 reasons I basically got on TikTok. One is to educate people. 2 is to advocate. I wish it wasn't that you had to push for your own care and seek out
Mm-hmm.
what you
Yeah.
need and advocate, whether it's to get the right testing or to get the right prescription or even to get the right dietary advice or whatever. You just have
Mm-hmm.
to be your own patient advocate. And the third reason is to embarrass my kids, which I don't know if I'm doing that or not. I literally like laughter is good medicine. So I like laugh at other, there's some really funny creators on there, like a lot of content. But yeah,
That's
so I think
hilarious.
the only thing is like, that's the biggest thing is like, if you think something's wrong, something might be wrong. And don't let people tell you there's nothing wrong and it's normal.
Yes.
And that's
Yes.
the message is that, seek it out. We're blessed that we have internet now. We have social media. You could do your research. Don't
Yep.
put up symptoms. Find someone
Hmm.
that can help you. And you're right. You have to have that attitude that you want to have prevention and you want to invest in yourself. And not everybody has the means or not everybody wants to.
Yeah. Right. As long as there's the opportunity there. Thank you for providing it to us. Dr. Tara Scott, thank you so much for joining us. It was an absolute pleasure. And we will be checking back in with you and promoting anything that you come out with in the future. So, all the best in 2023.
And thanks for all you do and all the hard work that goes into. I know it's hard, so I appreciate your time.
You bet.